It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone, and welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz. We're live on what's going to be a beautiful Sunday. So glad you could join us. Wake up, and if you have a question, give us a call at 1-800-848-WABC, 1-800-848-9222. Good morning, everyone. Dr. Cheetham is in the studio with me this morning. How are you, Philippa?
Good morning, Aaron. How are you?
Good, very well, thanks.
Spring is finally here.
It looks that way. Yeah, certainly, very nice weather. I want to remind everyone again that we are having our annual Men's Health Seminar. We'll focus on prostate, of course, as we always do. But this year, beyond just the prostate, right, Philippa, we have a number of lectures at the Men's Health Seminar that will deal with men's health, integrative medicine, maintaining bone health, also cardiac health, and sleep disorders. And to register, you do need to register because it is already filling up. It's on June 15th at the beautiful Garden City Hotel, and it's very easy to register. You just go to menshealthseminar.com.
That's right. And for those that don't have access to the internet, if you ring 516-663-9615, that's 516-663-9615. Our meeting coordinator, Joanne Constantini, will get back to you so you can leave a message, and Joe can help you register if you're not on the internet. You know, Aaron, we talk a lot about prostate cancer, but more and more it's clear that all these things are related: prostate cancer, heart health, sleep health, sexual dysfunction. Low
testosterone, too, we'll be talking about there. You're absolutely right, Philippa. They are all interconnected and can have a major impact on men's health. But here, I think the beautiful thing about this seminar is not only are you going to get, great, wonderful lectures from outstanding speakers, and most of them, not all of them, but most of them are a Winthrop faculty, but you'll also get to meet and greet other men and their spouses as well, who are also dealing with a very similar situation that you are.
That's right, and we're not just talking about early detection of all these things, but we're talking about prevention. So we want to this is a very positive seminar, so don't think that if you haven't been diagnosed with prostate cancer, there's no benefit, because we want to help those men to reduce their risk and to improve your cardiac health and improve your blood sugar levels and improve your sleep health. So it's a very positive seminar and a great gift for Father's Day weekend.
Absolutely. And, I also often hear from many of the patients that come to the office, I missed your show last week. How do we get that? Last week we had Dr. Jonathan Haas on, who runs the CyberKnife program, a terrific show, some very interesting callers. And if you missed it, it's very easy. You just go on to the website, which is wabcradio.com, and look under Katz's Corner, and you can get all the podcasts. And in fact, Philippa, we're about in the next month to celebrate our 3-year anniversary on Mother's Day.
That's right, and we're also on YouTube.
Is that right?
We certainly are.
Didn't know it.
There you go. All
right, Crash, are you ready to take, can we take some phone calls? He's got the thumbs up sign, and the phones are hot. And let's go first to Rich in Edison, New Jersey, who has a question about a biopsy. Good morning, Rich. How are you?
Hi, Doc. How are you doing?
Okay. What's going on this morning?
Okay. I had a biopsy done about 3 weeks ago, right? And
I don't know. That's what you're telling me. Yeah. Okay. Yeah.
Okay. And I had no cancer, right? But he said my prostate was 100 grams.
Okay. How high was the PSA, Rich? Why did you have a biopsy?
PSA was 7.4.
And how old are you?
70.
Okay, 70. Okay, well, you sound pretty young there. And what happened after the biopsy? So there was no cancer, thankfully. But what happened then? Okay,
right after the biopsy, I started urinating at night. Oh my God, 15 times, 16, 17 times a night. It was unbelievable.
Well, you may have had an infection there. You know, I mean, you may have developed a urinary infection if that happened, or the prostate may have swelled because you had. Right, Philip? I mean, the patients that have a large prostate like this, first of all, your PSA was probably normal based upon the size of your prostate. But did you have any fever, Rich?
I had a low-grade fever after the biopsy.
All right.
The thing is, I have a backache. I got a backache, too.
Okay, yeah.
They found out I had a urine infection.
Yeah, it certainly does. It certainly does.
And I was getting up so many times. So I went back. He did a ultrasound on me. Right, and they said, well, your prostate is now 114 grams, so I guess it swelled from having
you know, Rich, probably not. I mean, you know, it depends upon where the doctor puts the cursor or the, you know, and how you take the measurements. The bottom line is, you know, and I'm going to ask Philippa what she thinks. You've got a very big prostate. You probably developed a urinary tract infection. You don't need an ultrasound. What you need, my friend, is to get another urine culture to make sure that you don't have one of these resistant bacteria that we are seeing more and more in the community. And thankfully, I'll tell you, my infection rate, you know, being at Winthrop about 14, 15 months, thankfully, I mean, is less than 1%. It's very, very low. But it can happen. The community standard infection rate is about 3%, and at Winthrop we're way under 1%. But you know, Philip, what do you think here?
Well,
okay, so let me.
Go ahead.
Okay.
Go ahead, Rich. You have another.
Okay, let me tell you what happened. So Thursday, I went back. This past Thursday, and I said to him, I just don't feel good. I wasn't getting up at night. I was only getting up a couple times at night, but I just didn't feel good. My back was bothering me. Went back in. They took a urine culture. Came back. Still a urine infection.
Yeah, I'm not surprised. Yeah.
And we put me on Zipro.
Yeah.
Right. Now, Zipro, this is what I want to know, is I'm going to the bathroom a lot now with the Zipro. Is that normal?
Okay, well,
or is that...
you know, you may have developed a swelling of the prostate, which may have caused you to go into urinary retention. And, you know, one of the things that I probably would do on you right now, Rich, if you came to our office, you live in Edison, you could come see us in Manhattan, is to do an ultrasound of your bladder to make sure that you're emptying well, because you may not be emptying. You may have developed this infection. Your prostate may be swelling, and you may need to be put on some intermittent, at least some medication to help with that. What do you think, Philippa?
Well, lots of issues raised there, Rich. First thing, just reminding me, a patient who came in with a very large prostate who was about to have a biopsy. He actually asked me, does the biopsy cost more money if you have a bigger prostate? And I said, no, it's the same price, whether you've got a big one or a small one.
That's true.
But in all seriousness, I mean, there is a risk of a urine infection with a biopsy, and it's very important that anybody who's having a biopsy, that their doctor does a urine culture before the biopsy to make sure that the urine is sterile before we even start. We do give antibiotics.
And it was okay.
Sure. We do give antibiotics before, during and after the biopsy, but there is increasing resistance to antibiotics worldwide, and so just because we've given you antibiotics doesn't mean that gets rid of the risk completely. The other thing to say is if you have a very large prostate, then you may have had some difficulty emptying your bladder before the biopsy that you may not have even been aware of. And so if you had residual urine that was left behind, then this may account for your increased risk of infection. Interestingly, also, there are patients who've had a prostate biopsy, and I'd be interested to see what you think to this, Aaron, who have quite marked urinary frequency and urgency in the absence of infection.
Yeah, absolutely.
And sometimes the biopsy can stir up the evil spirits.
Yeah.
But, you know, it's important to tell patients that before the biopsy. One final thing as well is that if you have had a urine infection, particularly if it's been a nasty infection that's not responding to antibiotics, when you mention this pain in your back, I'm just thinking, have you got some infection that's travelled up towards the kidney? And there may be some advantage if this is not clearing up to getting some imaging of the kidney, make sure there's not a stone there that's predisposing you to infection. And you certainly would be worth evaluating.
Very good points, Philippa. Also, I think, Rich, if you're not emptying the bladder, the urine may be going back up into the kidney. So an ultrasound of the kidney, especially if you're having persistent back pain, I would definitely do that.
Yeah, so. it's. I wouldn't say it was persistent, but it's there. You know what I mean?
Yeah, sure. I think you need to.
I never had it before.
Okay. Well, listen, if you want to come and see us for a second opinion, we'd be glad to see you. I know you live in Edison, but we have offices on Park Avenue. The Winthrop Urology has now moved out to moved to as well Manhattan. So we have office on Park Avenue as well as in beautiful Garden City. Good morning.
Thanks for your call, Rich.
Yeah, thanks for your call, Rich. And that was, listen, I think what he'll need, Philippa, is he'll probably need another urine culture. He may have one of these lingering infections. And as you mentioned, the evil spirits, well, it could be inflammation as well that can occur when you start to put in needles into the prostate and you can get this inflammatory pathway. And that's kind of why I'm somewhat, I see so many of the patients that have early stage prostate cancer. And, we've talked a lot about this, about not doing additional unnecessary biopsies, but following them by the PSA or, the MRI unit that we have out there.
That's right. And we do so many prostate biopsies, and I think it's important for anybody out there who's about to have a biopsy or has just had a biopsy or somebody in the family is about to have a prostate biopsy. If you have any symptoms of flu-like illness after a biopsy, that's something that we want to know about. You must tell your doctor straight away because it is possible for infection to get into the blood, and it may just present with these flu-like symptoms and a fever. So get medical advice ASAP.
You're right. And, the reason that we're seeing more of these types of bacteria is that, doctors continue to prescribe antibiotics and more antibiotics. And then what happens is you get these resistant bugs. And even though he was placed, it sounds like appropriately on antibiotics before, during, and after the biopsy, if you have that type of a resistant organism, you're going to get a fever and you can get an infection. Sometimes it can be real bad.
That's right. And like anything, an invasive procedure, there's pros and cons. So, we're not saying that there is no role for a biopsy because it's very important for people who have an elevated PSA to get that information. The PSA does not tell us whether somebody has prostate cancer. We need a tissue diagnosis. So, I hope that you feel better soon, Rich, and we're happy to help if you get in touch with us.
7:15 in the morning, if you're just waking up, Katz's Corner on WABC Radio. If you have a question, please give us a call at 1-800-848-9222. That's 1-800-848-WABC. We want to remind everyone to make sure that you register for our prostate health seminar. It's very easy. It's on June 15th, 2013, and it's menshealthseminar.com. Crash, let's go to Mary in Manhattan. I know you've been waiting on the phone. Good morning, Mary.
Oh, good morning, Dr. Katz and Dr. Cheetham. Hi, my father's 92 years old, and I used to give him, it used to be called a herbal prostate combo. It was a pill that had saw palmetto in it, pycnogen, and stinging nettle. But I stopped it like 2 years ago. And 2 years ago when I had his PSA done, it was 2. But I'm going to I'm going to have them take the PSA this Thursday. Should I also? Is there something that with the Gleason? Should I find out what that is?
Mary, your dad's 92.
92.
Okay, I think he's done beyond the area where he needs, the age area. I mean, his age range where he needs a PSA. Believe me, I'm pro PSA. I mean, Philip, I get your thoughts, but 92 years old with a PSA of 2, I think you can leave. I think he doesn't need a PSA anymore. I think this is the type of a situation where at 92, it's unlikely that, prostate cancer, if it were to develop, is really going to affect his life, Mary. Philippa, what do you think?
Well, I can tell you, Mary, there are many 52-year-olds who would be very jealous of your father's PSA being
true.
That low.
That's a good point.
That's very, very respectable.
That's right.
The Gleason score is something that is related to prostate cancer, and it's how we diagnose, how we grade prostate cancer on a biopsy.
Yeah.
You're a fantastic, caring, loving daughter, but I don't think your father really needs to be having PSAs. If his last PSA was 2, I'd just open the champagne and celebrate that.
I think you're right.
But listen, okay, with Dr. Katz, one more thing.
Yes.
Now he goes to bed like around 11 o'clock, but at 3 o'clock then he goes to the bathroom.
Okay.
Should I be concerned? And then he goes again at 7.
No, 2 times a night. Again, like Philippa said, there's a lot of 55-year-old guys that would be jealous of that. That's normal. He probably has a little bit of overactive bladder. If this is a really stable type of a situation, Mary, and as Philippa said, you're a loving, caring daughter. I think it's wonderful that you continue to care for him. But I think overall, urologically, he sounds okay, Mary. All right?
Okay. And so then I don't need to order that prostate combo.
I really don't think you do need. No, Mary.
Oh, listen, thank you so much. The two of you are just wonderful. I don't know what I would do without you.
Oh, you're sweet. Thank you for tuning in every Sunday. Let's go to Ben in Queens. Good morning, Ben. How are you?
Hello, Doctor. How are you?
Okay, good morning. How are you, Ben?
I'm fine. I have an enlarged prostate.
Okay, Ben, just turn your radio down because we hear it in the background. Go ahead.
Okay. I have an enlarged prostate, and I retain urine.
Ben, you need to turn your radio down in the background because we're getting a lot of echo in the background
here. Okay,
I
got it. I retain urine. I take Flomax. I have no other problems, but when I go in for an examination, they want to do a scraping on the prostate.
Oh, okay. Well,
but I have no other problems. I sleep the whole night.
Okay, so why do they want to do a scraping of the prostate or a laser or a green light laser, which we do quite a bit at Winthrop, but it's really for those patients that have been on the medicine, like you said, Flomax, and where their Flomax isn't working anymore. I mean, it sounds like it's still working for you.
It's working fine.
So what do you need to have a procedure for?
Because they say that the retaining of the urine could be a problem to the kidney.
I have a question for you, Ben. Have you any idea how much you retain? Have they given you an idea whether it's 50 mils, 100 mils, 500 mils?
No, closer to 150.
Well,
CC. They were using CC.
Yeah, CCs. I mean, if it's between 100, 150, and your urinary symptoms are stable and you're not really bothered and you're maintained on the Flomax, that could be a chronic situation for you, Ben. We'd love to see you for a second opinion if you'd like, but I think, I wouldn't rush to do a procedure on you.
So retaining of the urine is not that serious a problem?
No, it can be, Ben. It certainly can be, and that is a reason why you may need a procedure if you're having, volumes that are much higher than yours or symptoms that are much higher.
Okay. Couple of things to say, Ben, that urine inside the bladder should be sterile, and if it's not draining away, then you can get problems related to urine infections that can result in bladder stones. You can get back pressure on the kidneys at large volumes.
Excuse me, I'm sorry to interrupt. My urine was clean when they examined it. There was no infection in the blood.
I'm not hearing any reason to do a procedure here.
No. I mean, I had a gentleman a few weeks ago who had a residual volume of 1,700 mils. He had no symptoms whatsoever, but long term that can also affect how well the bladder empties. That doesn't sound like you, and at 1 to 200 mils, it's not such an issue.
No.
I mean, one thing you can train yourself to do is to try and empty your bladder regularly and do what's called double voiding. So if you go to empty your bladder at night, then just before you go to bed, try and empty your bladder again, and that can keep those residual volumes down. But it doesn't sound like you need to rush into a procedure. Thanks for your call.
Thanks, Ben. I appreciate it. Philip, I saw a patient back this week who was just so grateful about this procedure that I did a few months ago called the green light laser. But this was a patient, I really changed his life. And, people say, why did you ever go into urology? And, if you can have a patient like this patient that I had this week who was just, his whole quality of life had been around his urinating. He couldn't go out. He couldn't go to the movies. He couldn't have dinner with his wife. He was looking for the bathroom wherever he went. He was on this medications and still having all those symptoms.
Well,
and then, we do the green light, and then it's an outpatient procedure. It takes us about 20 minutes, and he's just, just phenomenally improved.
It's amazing. And so often people think that urinary symptoms is part of getting older. Both men and women, I hear this all the time from patients. And there's so much that we can do, and people accept it so often as a part of aging. So, get medical advice. Go and speak to a urologist, because there's so many new medications out there. You may not even need medication. Simple lifestyle advice. Preventative medicine can help as well. Wow, the phones are on fire.
And it looks like a lot of men are waking up with a lot of urinary problems. Let's hear from Jack in Brooklyn. Good morning, Jack. How are you?
Hello?
Turn your radio down, Jack, and then we can hear you.
Okay, so I can't hear you too good on the telephone. Okay.
Good morning, Jack. How are you?
Okay. Am I on the air right
Yes,
now?
You're on the air. You're live. Go ahead, baby.
Oh, I notice when I go to the bathroom, my urine is slightly yellowish. I don't drink much water, and it has some sort of a odor. And I take a lot of vitamins.
Okay, well, if you take a lot of vitamins, Jack, it's going to make your urine turn a very bright yellow color. That's fine. Yeah. And it can also give you urine a little slight odor. I mean, if it's a foul-smelling odor, or if you have burning, you might want to come and see a urologist.
No burning at all.
Okay. And so what is the issue then?
Well, it's slightly yellow. It's slow. And I don't drink much water. And I take a lot of vitamins. I don't know if that would cause the odor.
No, well, it could cause the odor, but it sounds like you need to be drinking more water, especially if you're taking all those vitamins. A slow stream could be due to a number of conditions, but it could be due to an enlarging prostate. And, if you're not emptying your bladder well and the stream is slow, then you would want to you'd want to come in and see us for an evaluation.
Could that affect the kidneys at all?
Yes, it could affect the kidneys if you don't, again, like the previous caller. If you're not emptying, it's all plumbing. It's all connected. And the kidneys are connected to the bladder and to the urethra. And if you're not emptying the bladder well, yes, the urine can back up into the kidneys. It's rare to cause kidney damage, but it could. But if you're starting to have these symptoms, how old are you now, Jack?
87.
87. God bless you. Well, if you've never seen a urologist and this is starting to bother you, Jack, there are some things that we can do in the office for you, non-invasive. It won't take a lot of your time. And just to give you a little peace of mind, I think it'd be reasonable for you to come in and get it checked out. Philippa?
Yeah, not drinking enough water would that cause the symptoms? Usually
No, but you should be drinking more, it sounds like. Go ahead, Phil.
As Jack, one of the things that we can do very simply is we can do some basic urine tests in the office. We can do a flow rate where you pee into a machine and it measures how good the flow is, and we can offer both herbal and prescribed medications if need be. And as Dr. Katz says, we can do a bladder scan in the office to see how well you're emptying. For all the callers that are waiting as well, please, if we don't get a chance to take your call this week, next week we have a very special show on urinary tract health on Katz's Corner. We're going to be talking much more about all the issues that I see are coming up on the comments and the screen. So tune in next week if we don't get a chance to take your call, or by all means give your number to Crash, our producer, and I will call you back after the show.
All right, let's hear from Joseph, Sunnyside, Queens. Is he on the line? Joseph, good morning. How are you?
Good morning, Doctor. How are you? Thanks for taking my call.
Sure.
Yeah, I called last week, and I know I'm late now. It's 25 after 7. But anyway, I was talking about free prostate. I just went and had my prostate tested at New York Presbyterian. I have low-grade cancer. I got watchful waiting. But free prostate numbers came back at 0.780. And
what do you mean you're free? You mean you're free PSA? Is that what you're talking about?
Yes.
Well, but you've already had a diagnosis and it's been a low-grade cancer, right?
Yes.
But what is the total? What is the total PSA?
Okay, my total number PSA is it's up here PSA 4.69.
Okay, so and you have a low-grade cancer, so you're going to consider active surveillance, correct?
Right. That's what I'm doing.
Yeah, and some of the things that we've talked a lot about here on Katz's Corner, and it's hard to know whether or not you'd be an ideal candidate, but I probably would get an MRI at Winthrop just to check and make sure that your prostatic capsule is okay and that the doctors didn't miss any other areres of cancer. I think that would be important. You had that done, and how does that look?
It looked good.
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 Okay.
And I know I don't want to take up the time. It says percentage-free PSA 17. What do those numbers mean?
Well, those numbers really don't apply to you, frankly, Joseph. I mean, those numbers are really for the guy that has not been diagnosed with prostate cancer, and to use them to see if we should do the biopsy or not. So, you know what? I'm not going to get too crazy about that. I think that you're a good candidate, and perhaps you should go on to our active holistic surveillance protocol that we have with diet and herbal compounds. And, if you'd like, we can call up after the show, or you can give us a call at 516-535-1900. That's our office, 516-535-1900, and be glad to talk to you more about that. Let's switch the topic real quick. Philip, you want to make a comment?
Just wanted to say that we have a lecture at the Men's Health Seminar all about PSA 2013, and we're going to be talking about the total PSA, what the free to total PSA means, what's PSA velocity, what's PSA density, and it's great. It sounds like you're doing very well, Joseph, on watchful waiting. Dr. Katz and I specialise in this active holistic surveillance. We don't just monitor your progress, but we actually give you some dietary dietary advice to keep yourself in remission for even longer. We can talk about diet, lifestyle, supplements, and all of that will be covered at the Men's Health Seminar. So if you want to join us on Father's Day weekend, Saturday, June the 15th, you can register menshealthseminar.com, or you can call 516-663-9615, and all of those issues will be discussed at the Men's Health Seminar.
We have a few minutes left. Let's just maybe change the topic a little bit, because Ralph has a question about a kidney stone. Good morning there, Ralph. How are you?
Good morning. A week ago this past Friday, I had to be rushed to the hospital because I just couldn't take the pain, and I didn't know what it was. I gave in after 4 hours. And I was diagnosed with a kidney stone. They did a CAT scan, and they gave me morphine and a drip so I wouldn't become dehydrated. Just this past Thursday, after 7 days of intermittent pain and come and go, I passed the stone.
Okay.
Now, so I fished it out of I put a surgical glove on. I fished it out of the toilet bowl. And what color is your typical kidney stone?
Well, Good question, Ralph. I mean, keep that stone and send it to take it to your urologist, because they can analyse the stone and find out what chemicals that stone's composed of. The commonest stone is called calcium oxalate, and they often look like a little bit of gravel off the drive.
Yeah, it could be a uric acid stone too, though.
That's exactly what it looks like.
Yeah, it looks like something off the driveway. Yeah,
well, save it, and we can send it to the lab and analyse it, and that will give us some information as to how to advise you to prevent further stones.
Have you had stones before, Ralph?
Never, but I'm 61, my brother's 71, and he's had a couple of them, and he's had couldn't pass them, and they had to have it. I think it was either blasted or that other method, the more invasive method, which.
Well, we have all those methods at Winthrop, but I think Philippa's point about you saving the stone. If you want to come and see us, we can analyze it, and then, Philippa, you have a number of different dietary ways of intervening based upon if it's a calcium stone, if it's a high calcium in your blood, or high uric acid.
I mean, stone prevention is something that can really make a huge difference to your risk of getting another stone, and they run in families, so diet is very relevant to stone prevention.